After examining the liver as a regulator of movement and adaptability, Chinese medical theory turns to the heart because it represents a different dimension of coordination within the system. Where the liver governs the smooth unfolding of activity over time, the heart governs integration, coherence, and the unification of function. The heart is introduced next, not because it is superior to other systems, but because it plays a central role in maintaining overall order. In classical theory, the heart is associated with governance rather than force. It does not initiate movement or store resources. Instead, it integrates activity, allowing different systems to operate together without fragmentation. This integrative role becomes especially important once movement is already underway. If regulation of movement allows activity to proceed smoothly, integration ensures that activity remains coherent. Without integration, even well-regulated movement can become scattered or misaligned. The heart therefore represents a different kind of balance, one that depends on clarity, connection, and coordination rather than timing alone. Understanding the heart requires shifting attention from motion to organization, from how things change to how they remain unified amid change. This distinction makes the heart a natural continuation of the study begun with the liver. The two systems are closely related but perform distinct roles. The liver ensures that activity can move. The heart ensures that activity makes sense as a whole. By studying the heart next, Chinese medical theory adds another layer of resolution to how balance is maintained across the system. It also introduces the idea that coherence itself is a physiological function, not merely a mental or emotional state. This perspective allows integration to be understood as something the body does, not just something it experiences. Before exploring specific functions associated with the heart, it is important to recognize its role as an organizer rather than a driver. With this orientation in place, the heart system can be examined without reducing it to symbolism or emotion. This sets the foundation for understanding how unity, clarity, and coordination are preserved within complex physiological activity. In Chinese medical theory, the heart is often misunderstood as a commanding force that directs the body through will or dominance. This misunderstanding arises when governance is mistaken for control. The heart does not impose action or force coordination through authority. Instead, it integrates activity so that multiple systems can operate together without conflict or fragmentation. Integration, in this sense, refers to the capacity to hold diverse functions within a coherent whole. Different processes may move at different speeds, serve different roles, and respond to different demands. The heart allows these differences to coexist without becoming disorganized. This integrative function depends on clarity rather than power. Clarity allows signals, responses, and transitions to be recognized and aligned appropriately. When integration is effective, activity feels unified even when complexity is high. Multiple demands can be met simultaneously without confusion or overload. This does not mean that activity becomes uniform. It means that variation is coordinated rather than competing. The heart's role becomes especially evident when multiple systems must respond at once. During periods of heightened demand, integration prevents fragmentation by maintaining a clear sense of overall direction. Without this integrative capacity, regulation and movement may still occur, but they do so without coherence. Activity may proceed, yet feel scattered or poorly organized. The heart does not correct this by increasing force. It restores coherence by clarifying relationships between systems. This clarification allows each system to fulfill its role without interfering with others. In this way, the heart supports order without rigidity. It allows coordination to remain flexible rather than imposed. Understanding the heart as an integrator prevents it from being reduced to a psychological metaphor. It also explains why disturbances associated with the heart often involve confusion, disconnection, or lack of unity rather than problems of movement or strength. By recognizing integration as a physiological function, the heart's role becomes concrete and observable. This perspective prepares the ground for examining how coherence is maintained under changing conditions. It also allows early signs of imbalance to be recognized before overt disruption appears. With this understanding, the heart system can be explored as a stabilizing influence that preserves unity amid complexity. In Chinese medical theory, coherence is not treated as a byproduct of healthy function, but as a function in its own right. The ability of multiple systems to operate together without interference requires ongoing coordination and clarity. This coordination does not occur automatically. It depends on a continuous process of integration that aligns activity across different functional networks. The heart is responsible for maintaining this alignment. When coherence is present, physiological processes do not compete for priority. They adjust to one another, allowing activity to unfold smoothly even when demands are complex or changing. This capacity becomes especially important when multiple systems are active simultaneously. Without coherence, regulation and movement may still occur, but they do so without coordination. Activity may increase, yet feel fragmented or disorganized. This fragmentation places strain on systems that must compensate for lack of integration. Over time, such compensation reduces efficiency and increases the likelihood of imbalance. By maintaining coherence, the heart allows the body to handle complexity without collapse. It provides a stable reference that keeps activity oriented toward a unified whole. This does not mean that all activity becomes uniform or simplified. It means that diversity of function remains intelligible and coordinated. Coherence also allows transitions to occur without confusion. Shifts in activity can be recognized and integrated rather than resisted or mishandled. This is why coherence is considered a physiological capacity rather than a mental state. It operates continuously, regardless of conscious awareness. Disruption of coherence may therefore appear as disorganization, distraction, or lack of unity across systems rather than as isolated dysfunction. Understanding coherence as a function clarifies why the heart is central to maintaining overall balance. It also explains why disturbances associated with the heart often involve issues of clarity and integration rather than strength or movement. By recognizing coherence as something the body actively maintains, the heart's role becomes tangible and observable. This perspective allows integration to be supported directly rather than treated as a secondary effect. With this understanding, the heart can be examined as a system that preserves unity amid constant change. For integration to be maintained, different functional systems must be able to communicate effectively with one another. Communication, in this context, does not refer to messages or commands, but to the capacity for systems to remain mutually responsive. The heart supports this responsiveness by maintaining clarity and continuity across functional networks. When communication is clear, changes in one system are recognized and accommodated by others without delay or conflict. This allows regulation and movement to adjust smoothly as conditions shift. Rather than acting as a central dispatcher, the heart preserves a shared field of coordination. Within this field, systems can align their activity without direct instruction. This form of communication is subtle and continuous. It does not draw attention to itself when functioning well. Its presence is recognized primarily through the absence of confusion or fragmentation. When communication becomes impaired, systems may still function, but they do so without awareness of one another. Activity may become redundant, excessive, or poorly timed. Effort increases as systems attempt to compensate for lack of coordination. Over time, this compensation places strain on both regulatory and storage-oriented functions. The heart's role is to prevent this fragmentation by sustaining clarity across interactions. Clarity allows systems to adjust proportionately rather than reactively. It supports cooperation without requiring uniformity. This explains why disturbances associated with the heart often involve confusion, misalignment, or lack of coherence rather than simple excess or deficiency. The issue is not absence of activity, but absence of coordination. By maintaining clear communication, the heart allows complex activity to remain organized without becoming rigid. This capacity is especially important during periods of transition or high demand. As conditions change rapidly, communication must remain fluid to preserve balance. When this function is supported, systems respond together rather than in isolation. This shared responsiveness allows the body to adapt efficiently without losing unity. Understanding communication in this way reinforces the heart's role as an integrator rather than a controller. It also clarifies how coherence is maintained dynamically rather than imposed. With this perspective, integration becomes a living process that can be observed and supported. Early imbalance in the heart system does not usually appear as dramatic dysfunction or obvious failure. Because the heart governs integration and coherence, disruption tends to emerge as subtle fragmentation rather than loss of capacity. Activity may continue, yet feel less unified or less clearly organized. Multiple processes may compete for attention rather than cooperating smoothly. This fragmentation is often experienced as difficulty maintaining clarity when demands increase. Transitions that once felt coordinated may begin to feel scattered or poorly aligned. Unlike early liver imbalance, which affects the smooth unfolding of movement, early heart imbalance affects how activity is held together. Movement may still occur efficiently, but without a sense of coherence. Effort increases not because regulation has failed, but because integration is weakened. Systems may respond independently rather than in concert. This independence creates redundancy, misalignment, or poorly timed responses. Over time, compensatory patterns develop as systems attempt to maintain order without effective integration. These compensations often involve increased effort, heightened regulation, or excessive control. While such strategies preserve function temporarily, they do not restore coherence. Early heart imbalance is therefore best recognized by changes in organization rather than strength or activity. Signs may include difficulty prioritizing, reduced continuity across tasks, or challenges maintaining unified focus. These signs reflect a shift in integrative capacity rather than a loss of function in individual systems. Because fragmentation develops gradually, it is easy to attribute these changes to external stress rather than underlying imbalance. However, persistent fragmentation indicates that coherence itself requires support. By recognizing imbalance at this stage, intervention can focus on restoring integration rather than suppressing activity. This approach preserves flexibility and prevents deeper disruption from taking hold. Understanding early heart imbalance reinforces the importance of addressing coherence before dysfunction becomes entrenched. It also clarifies why interventions aimed solely at increasing or decreasing activity may miss the underlying issue. By supporting integration directly, the system can reorganize naturally without excessive effort. This perspective maintains alignment with the broader emphasis of Chinese medicine on prevention and early recognition. Because the heart maintains integration and coherence, imbalance within this system rarely remains confined to one area of function. When integration weakens, other systems are forced to operate with reduced coordination. Regulatory systems may increase effort to compensate for loss of coherence. Movement-oriented systems may become overactive in an attempt to impose order through action. Storage-oriented systems may become strained as they attempt to stabilize fragmentation over time. These responses preserve function temporarily, but they do not restore integration. As compensation increases, efficiency declines. Systems expend more effort to achieve outcomes that were once coordinated naturally. This increased effort can create secondary patterns that obscure the original source of imbalance. What appears as excess or deficiency in one system may therefore reflect impaired integration rather than localized dysfunction. Because of this, addressing heart imbalance often produces widespread effects without direct intervention elsewhere. When coherence is restored, systems resume cooperative function without needing to be forced. This restoration allows compensatory tension to release gradually. Activity becomes more efficient, transitions become smoother, and effort decreases. The heart does not correct imbalance by suppressing activity or increasing control. It restores order by re-establishing clarity across relationships. This explains why integration is prioritized before attempting to correct excess or deficiency. Without coherence, targeted interventions risk reinforcing fragmentation. With coherence present, adjustment occurs naturally across the system. Understanding how heart imbalance propagates reinforces the relational logic underlying Chinese medical theory. It also demonstrates why treating systems in isolation rarely produces lasting change. By supporting integration, balance is restored through cooperation rather than force. This principle prepares the ground for examining additional Zang systems with greater clarity. Each system will express imbalance differently, yet all depend on coherence to function effectively. With the heart system understood, the course can proceed toward other networks that contribute to stability, transformation, and regulation. This progression allows complexity to increase while preserving intelligibility. In this way, the study of Chinese medical theory continues to deepen without becoming fragmented.